and welcome. My name is Teresa. I'm one of the directors here in Warren House Vet, and today we're going to talk about our procedure for pre-operative assessment and how we minimize the risks to animals during surgery. The reason for it is during surgeries things can go wrong on the surgical side as well as the anaesthetic side. Now there are reasons why this can be more likely, so I'll show you how we try to prevent it. So first, when you call, we schedule a pre-operative assessment. It's compulsory at the practice for everyone, no matter how small the animal or young the animal is, or no matter how trivial the procedure is. So when you come to the consult room, here we do the basic assessment. So we obviously check for heart murmurs because cardiac conditions can affect the cardiovascular stability during the surgery. We offer blood tests because in animals there can be insufficiency of the kidneys or the liver. They can be developing slowly, so there are no obvious symptoms, but it will affect the anaesthetic because the anaesthetic drugs and agents we use get excreted either by liver or kidneys, meaning if those don't work well, it can accumulate and it can cause problems. Once your pre-operative assessment is done, then we schedule the surgery. We usually aim to schedule it within 1 or 2 weeks so that the information is still fairly accurate. On the day of the surgery, we admit you through the same consult rooms and we go through the consent form again and we again discuss the possibility of bloods. Don't feel pressured when we offer bloods over and over again. It's more that it's highly recommended for certain animals. For example, when the animal is over the age of 8, there is a good likelihood that there is some underlying problem, meaning we could anticipate, we could mitigate. We could, for example, put them on fluids during the surgery, so again, making it safer. On the day of the surgery, we hold a morning meeting. So the surgeon checks the list the day before to have an idea what animals are coming in for what surgeries. In the morning, we reiterate for the whole team what are the anaesthetic concerns, what are the surgical concerns. We have, obviously, a ventilator, so we tend to use ventilator for high-risk cases. There is an anaesthetic grading called ASA system, so anything above ASA 2 goes on the ventilator, usually has IV fluids as well during the surgery. The other part of it is that we also decide if, for example, we have puppies or very old animals or very unwell animals. A typical example would be a 12-year-old bulldog, very obese, coming for a dental. So that's a very high-risk anaesthetic. So this is the kind of cases we would try to get our most senior nurse to do the anaesthesia or monitor the anaesthesia. Also to have a surgeon who is competent and quick so that the anaesthetic is not too long. And again, we would put them on the ventilator. So after the surgery, it's quite important to recover them well. So the recovery is probably as important as the monitoring of anaesthesia during the surgery. So we have obviously our kennels and catteries separate, and we have a dedicated staff for recovering. Now when we recover, again, high-risk patients like the brachycephalic dog after a dental, we tend to allocate a nurse and we tend to do like an intense recovery, so somebody is effectively sitting with the patient the whole time until they fully recover. Now, as long as the recovery is nice and smooth, we obviously send them home and then we follow them up. The day after, we follow up by a phone call or a text, and the usual post-op checks are sort of 2 days and 7 days afterwards. We normally include 2 post-op checks free in the surgical package. Well, that's all for today. Thank you for watching. I hope you can now appreciate how much thought goes into the safety of the animals in the practice, and hopefully you're not going to feel offended next time we suggest that we can do some bloods before the surgery or when we call you back to see how your animal's doing, because as I said, it's all part of the process how we look after them.